The advancement of technology has impacted nearly every facet of our lives in one way or another. In healthcare, electronic medical records have turned modern healthcare into a complex healthcare system that has changed the face of patient care as we know it. Development of family healthcare teams, centers of clinical excellence, and digital imaging has become part of the new norm within healthcare. With this comes a necessity to streamline the transfer and sharing of health information, reduce duplication, and coordinate care. The adoption of electronic medical records will ultimately lead to an improved healthcare system across the board. This video will analyze interprofessional collaboration in relation to electronic medical records. Communication is a vital part of any healthcare team, especially ones that are providing patient-centered collaborative care. A patient's medical records and information needs to flow easily from one healthcare professional to the next without delay in order to maximize the team's effectiveness, and it's EMR that can enable that. EMR is being adopted rapidly. Since 2006, the amount of primary care physicians that have adopted EMR have more than doubled from 23% in 2006 to 56% in 2012. Since EMR is being implemented so rapidly, this allows patients to reap the benefits as it makes healthcare providers' workflow more seamless. On top of that, EMR will improve interactions and communications within the healthcare team, as well as between providers and patients. Having a patient's information at hand whenever they visit any healthcare worker enables each healthcare worker to know the status of the patient and what other healthcare professionals have been doing with the patient. Through EMR use, patients can reap the benefits of a healthcare team that is effectively communicating and collaborating, which can in turn improve quality of care and its outcomes through chronic disease management and preventative care. A healthcare professional can monitor any ongoing disease that a patient has, and any notes or other symptoms that other professionals add to their file will be visible next time for professionals to use. Since there is better communication with the patients, they can spend less time with providers as well as in waiting rooms, since they no longer have to repeat the information, which means that the process of communicating information with EMR far surpasses other forms. There are also other ways EMR can help improve communication with patients and providers. With EMR, there can now be open communications with patients through online portals and reception area kiosks. In terms of communication use, it is clear that EMR is making healthcare professionals' job easier, which will then result in better communication on all fronts, which is something paper systems simply couldn't do in a timely fashion. By implementing EMRs, doctors and nurses alike need to learn how to implement these systems, as well as learn the way that they work to better serve the needs of the patients. Doctors and nurses need better collaboration and communication amongst one another to allow the EMR to serve the intended purpose. Also, the healthcare technology industry needs better improvements with EMRs, so nurses can better document detailed patient data and reduce any physician confusion. An article conducted by Kalman et al. Highlighted electronic records effectiveness in interdisciplinary practices. It was a 13-question online survey specifically targeting offices. The responses included: improves communication between mental health and primary care providers, allows us to track what each provider is doing with the patient, and we can support each other's treatment plans with transparency. Easy access to medical concerns, a patient and medication list, allows good communication and collaboration between providers. Most physicians were pleased that the system allowed them to see their colleagues in other practices and notes regarding patients, which allowed for better communication between providers. Electronic medical records make entering, storing, and retrieving patient information faster and more secure. With the new advantages of EMRs, this form of healthcare administration helps physicians in shared practice environments provide better, safer care because each physician can access each patient's vital health information quickly and efficiently. Although the integration of electronic health records has many benefits to the healthcare industry, they also come with drawbacks that require very tentative management of the EMRs appropriately and responsibility. Since EMR's custodians are dealing with patient medical records, appropriate security must be in place to prevent unauthorized people from accessing patient information. Healthcare clinics can be held accountable if patient information is destroyed and/or misused. Electronic medical records come with the responsibility of monitoring patient medical files carefully. One method of security of monitoring is access logging. Must be enabled so one can monitor who is viewing your EMRs. Some security measures may include role-based permissions to access records, password controls, and/or encryption. By implementing these types of security measures, hackers will have a tough time getting through the system and hence protect patient EMRs. EMR's custodians have the responsibility to protect patient EMRs using reasonable judgment. They must be responsible for obtaining any consent from patients that require the disclosure of their EMR information. EMR's custodian should use reasonable efforts to ensure EMR information provided to the information manager is correct and to correct errors, where possible, after their discovery. Physicians also hold some responsibility. Physicians who use an electronic patient record system that they don't control need to have signed agreements describing how the information they enter will be managed and shared. When it comes to the disposal of EMRs, the disk must be wiped clean or rendered unreadable so the information can never be retrieved. The electronic medical record documents care provided to the patient contain information related to diagnostics, medication, and care plan. The use of EMRs can bridge the gaps between science and practice, and to inform diagnosis and treatment decisions and permit more accurate prognosis. The major benefit of the EMR include providing an instant summary of the thousands of notes and data points from the current and previous health encounters. The EMR is seen as an integrated longitudinal data compilation that provides the user with the insight and knowledge about a patient's clinical experience up to the present moment. The optimized EMR is integral to embedding best practice standards and developing personalized medicine and treatment plans. The EMR facilitates access and coordination of interprofessional team members in patient and care planning. Effective communication and collaboration between these multiple providers is essential to provide the highest quality of care possible to patients and their families. The successful interprofessional team ensures that communication is accurate and rapid to inform optimal healthcare decisions. EMR is a valuable tool in communicating shared goals, defining roles, communicating and tracking outcomes in a collaborative care model. The expertise and input of the entire team is maximized. Reduction in errors, improvement in clinical alerts and reminders, and support for therapeutical decisions of this interprofessional team all contribute to improved patient outcomes. EMR has become a big part of healthcare in our modern society, and its impacts can be felt from the physicians to the patients. EMR is the framework for medical information moving forward, improving a variety of aspects of the real healthcare system in ways that we simply weren't possible without it.